Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Individual agents which are no more used, which are not used now, include first Tubacurarine. Tubacurarine is the first muscle relaxant which is used by Griffith. It has maximum histamine release and it has maximum ganglion blockade. So this maximum histamine release and maximum ganglion blockade will cause hypotension. Second, Gallamine. Gallamine crosses the placenta and this Gallamine is contraindicated in pregnancy. Third, Doxacurium. Doxacurium is almost eliminated and this Doxacurium is unchanged in pregnancy. Fourth, Pipercurium. Pipercurium has less side effects than Pancuronium. Agents used nowadays in pregnancy are
Agents which are used no summary. Agents which are used no more. Tubacurarine is the first muscle relaxant used by the Griffith with maximum histamine release and maximum ganglion blockade causing hypotension. Gallamine crosses placenta, thus contraindicated in pregnancy. Doxacurium is almost eliminated and it is excreted unchanged in kidney. Pipercurium has less side effects than pancuronium.
thank you and thank you for watching.